gonna let everybody in. Slideshow. Good evening, everyone. Good evening. Welcome. Welcome, welcome, welcome. Thank you all for joining us. We appreciate everyone. If I could make sure that all of our guests get in the room, I'd appreciate that. Good evening, everyone. Welcome to the fourth and final and a wonderful way to wrap up our wellness webinars for the month of February. Welcome, welcome. Good evening. I want to introduce myself. My name is Ellen Reeves. I am the second vice president of Zeta Phi Beta Sorority Incorporated, Alpha Alpha Omicron Zeta chapter. And I want to welcome you all to our wellness webinars. We've had one every Wednesday this month. And the last one, we are going to turn it over and give pause and give space to the men in our lives so that they can talk about the issues that affect them, this in terms of heart health and just overall health. I want to just take a few minutes to welcome everyone. And we start all of our presentations with paying homage to the founders of our sorority. These women we affectionately call our five pearls. Without them, we would not be here. We would not be in this space talking about Zeta and the impact that we make in this community. So we thank them for their vision, and we look forward to the work that we do. I also want to introduce you to the leadership of our organization, our international president and CEO, Dr. Stacy N.C. Grant, as well as the Atlantic Region Director, the Honorable Judge Beverly S. Tatham. Locally, in the Commonwealth of Pennsylvania, our state director is Olivia B. Miller, and very excited to have our very own local chapter president, Nikki Ferrier, RP, who will bring us greetings. Madam President.
Thank you, Madam Chair Reeves. Good evening, everyone. It is indeed a pleasure to be with you all again on our final installment, as Chair Reeves stated, of our Zetas Have Heart monthly awareness campaign. Tonight, we will be delving into the importance of men's health. We know that men play a pivotal role in our community. They are fathers, husbands, brothers, sons, nephews, cousins, and their health directly affects the health and well-being of the family unit. So I am just excited to sit back and learn along with the rest of you some key pointers in the importance of men's health and why we need to all play a role in making sure not only ourselves, but the men in our lives remain healthy as well, by bringing awareness, especially in June, which is deemed Men's Health Awareness Month. So I will turn it back over to Chair Reeves, and I'm looking forward to all we're going to learn this evening. Thank you.
Thank you. Let me just give you some brief information on the history of Zeta Phi Beta Sorority Incorporated. Zeta Phi Beta was founded on the campus of Howard University on January 16, 1920. Since its inception, Zeta has continued its steady climb into the national spotlight with programs designed to demonstrate concern for the human condition, both nationally and internationally. The organization has been innovative in that it has chronicled a number of firsts. It was the first to charter a chapter in Africa, first to form auxiliary groups, and first to be constitutionally bound to a fraternity, Phi Beta Sigma Fraternity Incorporated. The sorority takes pride in its continued participation in transforming communities through volunteer services from members and its auxiliaries. Zeta Phi Beta has chartered hundreds of chapters worldwide, including London, Belgium, United Arab Emirates, Ghana, and Liberia, and has a membership of 100,000 plus. The four founding principles are scholarship, service, sisterhood, and finer womanhood. Just a little bit of information about our local chapter, Alpha Alpha Omicron Zeta chapter, of Zeta Phi Beta Sorority Incorporated, has was chartered by 11 women on January 15th of 2015 on the campus of Holy Family University in Northeast Philadelphia, Pennsylvania. History was made as it became the first four-letter chapter to be chartered in the Commonwealth of Pennsylvania. Several local sorors came together with a purpose and a plan to provide service throughout the communities of Northeast Philadelphia and Bucks County, Pennsylvania. A comprehensive plan was created for future community partnerships to highlight multiple Z-Hope activities and other national initiatives of Zeta Phi Beta. Alpha Alpha Omicron Zeta chapter continues to widen its reach and provide dynamic community service to the residents of Northeast Philadelphia and Bucks County, Pennsylvania. We are awesomely amazing AAOZ. So let me just do a little bit of a level set and tell you all why we're here. One of our national initiatives is it's called Zetas Have Heart. It's under the umbrella of Zetas Helping Other People Excel, which is our overall service program in the sorority. And under Zetas Have Heart, we take the month of February to bring awareness to heart health as well as overall health and wellness. So the goal is to prevent, cure, and or manage everyday self-care issues through health awareness. So again, we are very excited to turn over the microphone at this point to our frater brother Miles Brown, who's going to introduce our special guest, and we're going to give them the time right now. So let me stop sharing, turn it over to Frater Brown.
Good evening. It is a pleasure to be with you all here tonight. My name is Miles Brown. I am the secretary for Sigma Alpha Sigma chapter of Phi Beta Sigma Fraternity Incorporated. And I am also a student at the University of Pennsylvania getting my master's in social policy. So today I wanted to take a little bit of time to talk with you all about the social determinants of health for Black people in the United States. While the information I may present in this slide deck right now is geared more towards Black men, please realize that this is an issue that affects all of us uniquely, each and every day, especially from birth. So for a little bit of an overview for what I'm talking about, I'm going to give you a little bit of introduction to the social determinants of health, talking a little bit about the impacts of not seeing a doctor, some challenges and opportunities that we face daily, some of the key takeaways that I have found when reviewing some of this information today, and a little bit into the Q&A where we're going to hear from Dr. Elmore and have some of his thoughts around all of this that we're talking about today. So what are social determinants of health? These are non-medical factors that influence health outcomes. They interact and intersect with all sorts of areas. They refer to the conditions in which people are born, they grow, live, work, and age. All of these factors in this figure to your left play a significant role in influencing our health outcomes and overall health disparities, some of which may include your socioeconomic status, your housing, your healthcare access, racial bias at the doctor's office, language barriers, and ultimately life expectancy. This is a quote from a Black person doing this talk with the Pew Research Center, where they mentioned that they had a situation where they had to go through 2 different doctors until I was able to get the results that they were requesting, because they did not believe that the issues that I had were valid, or that they were not as serious as they made them out to be. I feel like this speaks to a lot of the perceptions that I've had growing up with doctors, even though my mother is one. Recently, a member of my family had almost had negative health outcomes because they could not find doctors that were able to actually listen to his lived experience and what he was actually requesting from them. What does this mean then when patients are going into physicians' offices and they don't trust them because they're doctors, or they don't trust them even though they have a dearth of information, but it feels like the way they deal with African American patients are different than the way they deal with white physicians or white patients, excuse me. Ultimately, that means 20% of Black people will ultimately fare worse than white people across the majority of 30 examined measures of health. That means they're more likely to report financial barriers to receiving healthcare, and they continue to have a higher uninsured rate, which is 11%, than their white peers at 7%. Furthermore, they are also more likely to report facing social and other economic challenges that adversely impact their health. So what are some of these challenges and opportunities? Like I mentioned before, or like I just mentioned, they have a higher uninsured rate. So Black people, when we are wanting to get insurance, we are not able to, maybe because of economic opportunities, higher rates of unemployment, because for most of us, our insurance is connected to our jobs, lower income levels, and increased poverty. We have this fear of our pain not being taken seriously. As we experience racism and discrimination daily, we hope and want that to not happen at the doctor's office, but ultimately it does. And this contributes to further chronic stress, mental health issues, and other adverse health outcomes. Next and lastly, well, not lastly, but there's an underrepresentation of Black doctors across the United States. There's only 6% of Black doctors in the United States, and Black residents in counties with more Black physicians had lower mortality from all causes. This also contributed to a longer life expectancy, even in communities with just one Black physician. So what are some key opportunities here? I feel like when we're going to the doctor, we have to be consistent with advocating for ourselves and advocating for our needs. We have to ensure that there is enough collaboration, not just within the healthcare sector, but within healthcare, education, insurance, and a whole bunch of different sectors. Telehealth has become an increasingly accessible feature over the last couple of years because of COVID and the pandemic. But I feel like this could be a way to bridge the gap between a Black patient in an area that is not covered by a Black doctor. More community engagement is definitely another key opportunity here, where we are learning more about the healthcare system. We are learning more about the ways in which insurance works, and we are learning more about all of these factors. And lastly, healthcare reform, ultimately changing our healthcare system to work in the ways that we see fit, to work in the ways that we need it to. Systemic inequities persist across this wide gap, and we have to acknowledge the existence of systemic racism and persistent disparities in healthcare access. Like I had mentioned, technology can facilitate this access as we're able to explore the potential of telehealth services and technological advancements in improving healthcare access. Also, representation matters. We have to discuss the impact of underrepresentation in the healthcare workforce and advocate for increased diversity to build trust and improve cultural competence within healthcare systems. And now I wanted to pivot a little bit and bring in Dr. Dillard Elmore, who is the Regional Chief Clinical Officer for ChenMed. Dr. Elmore was inspired as a teenager to pursue a career as a physician. His favorite part of his profession is helping his patients work against preventable diseases. Dr. Elmore says he loves working with the senior population, and as he explains, seniors have a rich history to share and provide insight into our future. Dr. Elmore is passionate about providing every patient with quality care. As he says, I am dedicated to partnering with patients to attain the health goals they want to achieve. When not with patients, Dr. Elmore likes to stay busy. He enjoys spending time with family and friends, listening to music and audiobooks, working out, and traveling. He hopes to one day visit Greece, Brazil, and Ghana. Dr. Elmore he's also recently accepted a position as the statewide medical director for Georgia Department of Corrections that will take effect on March 1st, 2024. So, Dr. Elmore.
Hello, Miles.
Hi, it's great to see you. One question I had for you is, or I guess the first question I had is, how can individuals contribute to or participate in initiatives that focus on improving overall community health?
You know, I go to a lot of conventions, and sometimes it can be somewhat disheartening, and especially when you look at physicians who are then patients and they still have to deal with some of these social determinants of health, which a lot of times is discrimination. What I would say is we have to rely on our network. I mean, you guys have Zeta, Phi Beta, Sigma, all together. You have different organizations you have that you're part of. I think one of the key takeaways, we have to use our community. We have to be able to have conversations that show vulnerability, because a lot of times, if we're looking at our healthcare in isolation, we may think that we're going through something unique to us, or maybe have some shame or embarrassment or some fear, right? But when you open up, that's when the community lets you know, oh, I'm glad you brought that up because I've been dealing with the same thing. And then you can learn, okay, which doctor, even if you can't find an African American physician, which doctor did you work with that actually treated you fairly and seemed to be thorough and caring? It's just like anything else, sometimes word of mouth, but you can't get the word of mouth if you don't let anyone know that you're in the market for a specific type of care.
Thank you for that. Um, so, given what you said, what steps are being taken to address some of those biases, to address some of the discrimination within healthcare systems and among healthcare providers?
So the problem with healthcare is that healthcare, like you had that one case where they say, the doctor said, oh, I took the Hippocratic Oath. Or in the case of your mom and I, because we both went to the same medical school, the Code of Asclepius. So they think they don't have any biases, right? Because no one sees their own biases, right? Um, but I think if we can find ways to increase the number of Black physicians, and not just Black, but people who are coming from first generation, right, or that has some sort of, connection, and could understand, what it's like to either be poor or we're coming from we're not monolithic. So I think it's representation. And let me give you one example, and let me know if I'm being a little too long-winded. Historically, as a physician, I was taught, and your mom was taught, that the kidney functions of Black people are stronger than that of white people. So, give you an example. Let's say we have Miles Brown, right? You're biracial. You self-identify as African American, but your twin brother self-identifies as Caucasian, right? Now, the both of you go to your doctor, you get blood work to look at what we call your glomerular filtration rate, which is your kidney function, right? Now, mind you, your kidneys are the same, but your brothers will say your glomerular filtration rate of 40 if you're Caucasian, but 60 if you're African American. So he'll say, okay, mine is 40 because I'm white. This is a problem, his doctor will say. But the same doctor with you, who you self-identify as African American, will say, oh, it's 60. You're fine, right? So now your brother is going to get on medications to protect his kidneys. They're going to get blood pressure control. They're going to have more stringent monitoring of the kidney function, right? So now you guys are starting to diverge. Your brother kidneys are not being beat up by hypertension or whatever. And then 10 years down the line, when your glomerular filtration rate is what your brother's was 10 years earlier, you're actually in bad trouble, right? You're 10 years older, so you're not likely going to be able to get on the transplant list, so you're going to be lower on that. and your kidneys are more beat up, so you're more likely going to have need dialysis in a short term, right? Why is that? Because the arbitrary race construct has been put onto your kidneys and it delayed the care that you got, right? How did this start to change? University of Pennsylvania, there was some Black nephrologists and researchers that said, this is crap. There's no truth to this. I don't see a more muscular kidney coming out of Black people, right? It looked like it's getting beat up, right? And if you're gonna give all this, arbitrary social construct, if you're gonna make social constructs a physiological, right, thing, then of course we're gonna do worse. So in that situation, you've had doctors, myself included. I'm African American. I love Black people, right? I was giving poor care. Why? Because that's what I was taught. So it's so deep. We're gonna need more researchers like that. That's gonna. And now for me, I'm like, I don't even want to hear about race when it comes to a diagnosis. I don't care, right? I just need to know what do you have and stick to the objective, and I'm gonna treat everybody the same and more aggressively. So we need more people. We need more people to go into medicine. We need more people to go into research. But if you're an oppressed group, we need more people to become bus drivers. We need more people to become everything. But I would say make that a priority.
Thank you. Yeah, I mean, I definitely learned a lot. I mean, I knew some things from earlier around how my kidney function or my biological functions might be different or might be reported as different from a white man or somebody else, but I didn't really understand how much that would affect me. So given that you said something about research, um, how can either trauma-informed or racially informed research efforts contribute to that better understanding of disparities in healthcare and healthcare access or pain management and inform evidence-based interventions?
Well, you want to you want to hear the one funny thing where racism has actually benefited us? So if you saw in some of your slides and some of the life expectancies, over the past 5 years, there's been a narrowing of the gap between whites and blacks. Why is that? The opioid epidemic. Well, it didn't really affect us because no one believed we had pain. So no one started us on narcotics. So, we weren't becoming addicted at the same rate. And you see that is sometimes with some celebrities, my homeboy Prince, and things like that, where it's just a different thing. So, the reality is most Black people have not heard about Henrietta Lack. That's the woman who had her cells taken from her without her consent for become like cancer stem cells. Most Black people didn't hear about the Tuskegee experiment, right? What they heard about is their mother, their cousin, themselves, their children, right? This is immediate. This is something that was brand new. Like, I mean, you don't find, even me before medical school, even before, I started researching this, I wasn't reading, yeah, this Tuskegee thing makes me paranoid. No, it was the way doctors treated me. I mean, and I'm a physician. I went with my mother, and she had a condition, and I called this, Dr. Wonderful. I told him I'm a physician, and he looks at me like, so this is what we're gonna do. And I told my mother, we're not going to this doctor because this doctor is a a-hole, and has some other things about him that um, I think I think the medical community needs to have a deep catharsis. But as we've seen with George Floyd, everyone is all kumbaya, lovey, lovey, trying to make things happen until something new comes on TV, or something. So the real talk is we're going to have to be our own advocates. We're going to have to, not everyone is blessed like, your family, my family, to, have physicians in the family to advocate. But like I said, we have to share. We have to have those conversations. We have to use our resources, right? And that said, people who are in, the blue and white, brother and sisterhood, people who are in Jack and Jill and all of this, really in a really privileged, setting. You'll bend those ears, speak to your people. But also, my thing is, I have cousins that call me, and it's like, yo, cuz, like, what's up? I got this friend having some medical problems. She want to talk to you. I'm like, yo, put on. Because if we ain't gonna do it for each other, who's gonna do it, right? And we just, build that Rolodex and speak to people and share. And we if the thing I say about Black educated individuals is sometimes, in my experience, we didn't share enough. So every time you make a stride, it's like the next generation has to start with building the wheel again. But that's never how science works, right? You built the wheel. You taught me how to build a wheel, so I didn't need hours and months and years of training. Now I said, wouldn't that work well with an axle? And then the next group, oh, this wheel and axle. What if I add a horse to it, right? But if we don't share, every generation is pretty much starting at building a wheel again. So we got to share.
Thank you. So how can we have those conversations, but also how can we improve our health literacy so that we can better understand information and make informed decisions about our health, but also how can we go from not just building that wheel?
I think this is a great opportunity. I got to be honest, I'm pretty busy and I usually don't think to do things like this on my own. But if asked, I'd join. Listen, most of us, no matter what you're doing, if you're finance, if you're sociology, if you're law, most of us love to speak poetically, wax poetically about what we're passionate about, right? I used to want to, now sharing some information with you guys, and I see your sorority sister, Denise Marshall, is on here, so she's heard this story multiple times. I used to be a barber in Harlem, right? When I was trying to get into medical school, right? Which didn't seem very likely, at the time. And one of my dreams back then was having a medical barbershop, right? Where you could have Black men in their place where they could just be, let their hair down, for lack of a better word, right? And have those conversations. Men have very intimate conversations in the barbershop. And same thing with women and, the hairdresser, right? Where is a good place to check blood pressure? I mean, that's one of the most, if you can get a blood pressure checked, man, that's a big deal. If I could treat one thing for everybody, it would be their blood pressure. It's going to increase your chance of heart attack, stroke, kidney damage, right? And then there's other things after that. But if I can get a gateway of checking your blood pressure, man, what can we do? And having an environment where you feel heard. Did I answer your question, or was there another part that I may have missed?
No, I think you definitely answered my question. Thank you. What, so given all of this that we've been talking about, what are some things that each of us can take away, that each of us can start doing so that we can have better health outcomes, so that if we do have to go to the hospital, or if we do have to go see our doctor around something, that we are not starting from a place of that we're not starting from zero?
So, one thing I will say to all of you women of childbearing age, if you could get a Black OBGYN or midwife and start building that, because Black women have developing nation levels of child mortality and morbidity. It's a travesty. And then some of the what I did is I did some studies, and what it showed is that a Black woman in a poorer hospital had poorer outcomes than white women, but the delta was bigger for Black women in the suburban rich hospitals, which makes you wonder, is there a little bit of bias? Like, is there some protecting of, those environments? You're not supposed to be here, right? So try to find someone, a Black physician in our midwife, and build your network of advocates, and get smart about certain things, what to look out for, and have someone, if you can't find someone, have someone on speed dial, that's a physician, or that can actually have that conversation if you feel that you're not getting what you want. But get someone, start family planning, get someone that you feel you comfortable with and you could be an advocate with. Um, that's one of the key things that I will say. Um, do your research. I would say some easy thing is Medscape. I think Medscape um, is a good resource. Like it doesn't, from my experience, it doesn't go down like that snake oil path. It'll give you a nice overview. Of course, there's more things you can get other places, but look at things like that. Have good resources. Like I like Medscape. Uh, Good resources that you can look into and read about. Maybe periodically have something, with a medical professional, maybe a scientist, where we could just talk about things like this. I think this is a good environment, but a lot of it is going to be, unfortunately, in this country, it's going to be building those networks and having some people that you can just call up, whether they're in California, whether they're, you got to have those people. And for us, fortunately, you know, just gotta look hard and ask questions.
Thank you. Thank you for that. Lastly, I wanted to ask you just a little bit, just reflecting on the past couple of years that you've been a doctor, that you've been a physician. What has been something that's been changing, whether that be in the medical field, that you've been very supportive of?
The big thing is the awareness that what the hell is race? It's nothing. It didn't exist before chattel enslavement in America, right? Right? I mean, if you're gonna oppress people and treat them inhumane, you got to make them different, right? Um, and I think that there's that growing awareness that I don't. If I see it, if I'm working with a resident and they said 56-year-old African American, like, is there anything germane about African American? Truth be told, not even sickle cell is purely African American. It's any place that you have malaria that you're gonna, select, for the sickle cell trait, because that could be, so you could have Mediterranean people, so I don't need to know, right? I can't, the more you think about it, and I think a lot of doctors who are really in the know, the more you think about it, the less I need to know anything about your race. Do I need to know about your finances? Yes. Now, to one point, though, the race may be important, but that's just because you got to be aware of potential bias, right? But that's a social thing, right? It's the social determinants of her health, which is bias, racism, and all of the stigmata that comes with that. So I'm very pleased with that. But to the converse side, Black men just aren't going into medical school. It's just not. Medicine in general is turning, which is a good thing. It's becoming more of a woman's, the incoming class. I think majority of most medical students are women, which is not bad, but it's still, the numbers of Black people are not increasing. And for Black men, it's decreasing, So you didn't ask me that question, but that's something that I'm kind of concerned on. I think that, if the government, I mean, they should just make it free, for Black people who want to go practice in shortage areas where you need Black doctors, and give them a handsome reimbursement.
So what are some of the ways that we can get rid of those barrier blocks so that more Black men can go to medical school?
We got to be socially and politically active. I don't care what party you're part of. If we have, and this is, a big deal, and it's going to be your generation, Miles, political activity, staying at home, all you young people. It's not, if your candidate's not perfect, you know what? Go out there and get engaged. And the more our voices are heard and that we are diverse, the more we can do more. And if we, I think your generation build a platform, right? We cannot stand up for just tokenism. Oh, this is the first Black president. This is the first female Black. You know what? We need to hold people accountable. Not saying we're not going to vote for them, but just like with the Palestinian people are doing with Biden. I'm pretty sure they're going to vote for him, but they're putting in right undecided stuff. You want to do those things to push, right? But we need to become active. We need to become really active, and we need to support each other. I got to tell you guys, man, if any of your children, because none of my children want to follow in my footsteps, they don't want to be like your father, Miles. They want to do the other things. But if any of your children, man, get a mentor for them, show them. I mean, I would love to support. I know many other, Black doctors, male, female, who would love to support, show you the ways to go, the way to be gritty, the way to, make it happen. But it all comes back to community.
Thank you. Thank you for your time. Thank you. This has really been informative. At this time, I would like to open it to any other questions that we have. And I see one from Carmen. So she says, I work in a trauma-informed clinic. Majority of the patients are low income and limited resource. Unfortunately, the patients don't ask questions or advocate for themselves during medical visits. On a number of occasions, as a social worker, I have to respectfully interrupt with the provider and ask if the patient understands what they're hearing. As a social worker, how can I encourage my patients to speak up um, and how they are actually feeling about how they are actually feeling in a medical visit?
You know, this is a challenging question because a lot of it probably has to do. I'm assuming that most of the doctors that you're dealing with are not from the same ethnic group or racial group as the patients, right? Um, and we got to go a long way with breaking down the barriers of that, you know, uh, those microaggressions and those traumas and the legacy that our medical system has created a sense of not trust with our patients. And it's not probably something that's going to happen overnight. The more consistently you can work with them, and hopefully the physician or nurse practitioner uh, can train themselves, right, to develop a relationship with the patients. And another thing I often said is someone who's trained physicians and worked with a couple of physicians who, not all physicians are brilliant, as you guys have probably learned. I often found that some physicians utilize esoteric medical jargon to avoid questions. And some of them don't even know how to really explain it because they may not know it that well. Not trying to scare you, but a doctor a doctor should be doing their best to speak to you in a fourth or fifth grade level education. Keep everything as simple and as basic as you can. The more jargon a doctor says, and just think, the patients, I mean, think about it, right? Who knows what their education level is? A lot of physicians still, it's a very respected, very, esteemed profession. Some people might feel embarrassed that they don't know what these terms mean. So I think it really, as a social worker, just continue to try to explain things, and even have the conversation with the physician. I don't think your patients understand you when you use those words. Can you please slow it down? And ask the patients.
My next question from Nisha is there a way for older people to overcome their distrust of the medical system?
It's the same thing. I'm a geriatrician. I forgot to add that. So I'm a family practice, but working with kids is just not for me. I don't like seeing sick children. So, like, shortly after my peds rotation, I took a left turn. I don't like sick kids. I like healthy, fun kids and everything. And I was like, man, I'm gonna go towards the older population because I'm gonna get there soon and want to fix things up before I get old, so I could have some good healthcare. It's the same thing though. A lot of times, what you see, pediatrics and geriatrics are very similar, right? Pediatric, it's your parents advocating for you, asking all the questions, taking all the notes. Geriatrics is the children taking care of the parents, asking all the questions, right? Taking all the notes. So have your team with you, right? Have your team with you if you're geriatrics. Have maybe a son or daughter or somebody that can come or even be on the phone, right? Have that. Have an advocate, that's going to answer certain questions that, um, do that with someone you could trust, someone that you love, someone that could help to make decisions if you're not able to make them, and have those your advanced directives, all that other stuff, but have that conversation with those people, but bring somebody when possible.
Okay. And Deshonda is asking, in your experience as a Black doctor, how have you observed or addressed the impact of social determinants of health outcomes within our community? Are there specific challenges you've encountered or successful strategies you have implemented to address these factors?
So my last organization, Chin Med, one of the things that I drew me to them is that we were practicing something called value-based medicine. Now, it was just for seniors or people who are on Medicare Advantage. But what they tried to do is they said, we're practicing what we call full risk medicine, meaning if we don't have positive outcomes, we get no money. Because if our patients go into the ER, that's coming out of our pockets, right? So when you have that, you can be creative. You can say, the biggest social determinant of health for my patient is transportation. So instead of them taking $1,000 ambulance to the hospital because they couldn't come in to see me for their heart failure and their heart failure medication, why not get an Uber? $15 each way, $30, right? Still coming out of my pocket. Now the patient doesn't have to go to the ER. And guess what? What if they just can't get their medications because they have to go to the pharmacy and there's no one to take them to the pharmacy and we're not paying for an Uber to the pharmacy? You know what? Put a medical dispensary inside your clinic. So it's right there. You know what? You told me, Dr. Elmore, I shouldn't be eating these canned foods, but I can't get to the supermarket that frequently. So I need canned foods because they, stay preserved. And I know they got all that salt and all that stuff you're telling me, but I just can't do it. So most of our clinics share the parking lot with a supermarket. I don't care when you go home, if you go shopping and then we give you the link to press for your Uber, or if you come with your niece or your daughter or somebody and they go shopping or whatever. I really don't care, right? So the medical healthcare system, I think it'll be better when it pays physicians to be problem solvers, gives them more of the risk or more of the reward. Now you can start thinking outside of the box. And so, I started out working in what we call the FQHC, and I was drawn to it because I would be able to start a public housing projects practice in the basement of the projects. And I was excited, and my wife was like, dude, you wondering why they couldn't get anyone to do it, but I wanted to close those gaps. But there's more creative ways if you allow physicians who have some smarts the risk and the ability to be creative. New York State was paying about $20 million for transportation, for medical transportation. And this is back in the early 2000s. So I don't even know what they're spending now. But we weren't, CHMED was not paying that much because it's Uber, Lyft.
Okay. And Alexis is asking, how do you go about finding a good physician?
So there's a website, blackphysician.com or org. You can just Google, look for Black physicians, and you'll probably come to that website, and it'll show you some doctors. You could basically type that in and see, put in your zip code. There's also the NMA, National Medical Association, which is the oldest historically Black, physician organization in America. It's in every state, and you can go in there and you can look for physicians, whatever type that you want, and see which ones are nearest to you. And you could just even Google Black physicians near me, put in your zip code, and see which ones. I found my physician, at a medical conference, and I told her you could be my doctor, and she's like, "Oh, okay." And now, I've been seeing her, and my wife is going to start seeing her soon. But just do those looks. And you can even look at residency programs and see, the different hospital systems. Yep, blackdoctors.org. And just look for Black physicians. Um, and here's the deal. The Black physician is not the magical pill, because even if you're white with a white physician, you're not always going to get along with them. So just get to know them. See who you can have a rapport with, and who doesn't have a lot of dings on their license or malpractice suits. You want to do that search, but I would think most Black physicians are pretty good because we don't have that leeway.
All right. And how can we encourage people of color to go to the doctors, especially due to the distrust of the system or doctors?
Yeah, that's the $1 million question. Um, I think just having more conversations. And I think if you find a good physician, basically share the news about that physician, and even ask that physician if they know any others, right? Because what happens is with Black physicians, a lot of us have the desire to do the right thing, but there's another conversation about how physicians should take care of themselves from a mental point of view, because remember, the system is not just negative towards the patients, it's negative towards a lot of times the Black physician as well. So I say try to find someone by word of mouth that your loved ones have had a good rapport with and have had good outcomes with, and have those conversations. All right. And even sometimes it might not even be a Black physician just because you can't find them. But sometimes your loved ones will say, you know what? This doctor right here was good, treated me as, with respect and dignity, and I believe gave me great care. And we just have to have those conversations and share.
Thank you. Ellen, I see your hand is raised.
Yeah, I just kind of want to bring it a little bit back to the men in our life, right? So I think my question is, I think we all are probably aware that you physicians don't get a whole lot of nutrition training. And I did recall in your bio you like to work out, but um, so I'm really interested, what message should we be sending to our Black men in terms of health and nutrition and to take better care of themselves?
Well, I'm a believer in the Mediterranean diet, right? I believe, if you look back historically, the portions of protein and meat that we're eating, that was never right, normal in human society. I mean, if you look at, the Maasai, right? They're slender, they're cow farmers, but they don't use the cows to eat, right? They use it, they, drink some of the milk, they drink some of the blood, and that's a sign of wealth, right? Even chicken weren't really used historically just for slaughtering; they were used for eggs, right? Right? So, they say, moderation. They say the amount of meat you have with your meal should be around the size of deck of cards. Keep it the deck of cards. That's about you more vegetables. You can have some, starches. If you want to be really healthy, use less processed food. I like to keep things simple, right? The more you can have less processed foods, right? Use a source of oil like olive oil that's, kind of lipid neutral. Cook your own stuff. Don't put too much salt, not too many preservatives, anything like that. Uh, and just eat. Don't eat till you're stuffed. Moderate alcohol, moderate exercise, and avoid smoking. Just avoid it. But to your point, physicians typically aren't taught a whole lot of nutrition. A lot of nutrition that I've learned is more recently. There's other research that does show that if you want to feel better and overall healthier, the closer you can get to a vegan diet is great, but it's not really sure if they increase your life expectancy, but it may increase the quality of your life. So you might die at 87, but you're gonna die with less aches and pains and a little happier. But you're gonna die, right? So it's a question, and I'd rather have quality.
So
Thank
Becca's
you.
asking, is there any advice you have on sleep hygiene?
So I have a statement. The bed should be only be for procreation and sleeping. Get out the bed. Put on the blue filter for your light, your phone. The phone is like, that is the worst thing right now. And even for myself, that damn iPhone, yo, like, come to my room, go to my bed, think about wife sleep, then I see the little glow. Then I'm by beside her with the glow. Right? You're feeding all of this blue light, which is telling your body, and it's messing up your circadian rhythm because that UV light, the blue light, that blue wave is basically suppressing your melatonin. It's saying that, yo, it's time to be up. It's time to be functional. How many of you guys remember or have lived through a blackout where everything went out? What time do you go to sleep? Go to sleep late when the sun goes down, right? I remember doing Sandy, right? Sandy came, internet was out. I didn't download enough videos and my power was out. So we went to sleep. My whole family sleep by like 7:30, right? It's the blue light. If you're going to watch TV, do not do it in your bed. Just get out the bed. Sit in the couch, sit in the chair. Don't do it in your bed, right? And then when it's time to go to sleep, cut things off. Get off the phone, right? Which I need to preach. I need to be preaching to myself with that sometimes. But that's going to be the hygiene because there's two things that we're fighting against, right? So you have when you wake up in the morning, right? You're high alert, low fatigue. As the day goes on, you have decreasing alertness and more fatigue. And when they meet each other, that's when sleep should occur. Now, what happens if, like, you're driving or you're doing something that's forcing you to stay alert? Eventually, the fatigue starts to go down. And now we run into the insomnia, right? Because the fatigue can be suppressed. And this is when you get into the dysynergy of the two. And now, if you got blue light shining in your face too, saying, dude, why are you so damn tired? That blue light, the sun is up, right? So put the phone down and use the bed just for procreation and sleep.
Okay. Well, thank you. That was very informative. Thank you for your time. Thank you for answering all of these questions. I can't say I will be giving the phone up just yet. But it definitely giving me some food for thought.
Turn
Uh,
on the night shift.
that's already a thing. Yep, already have that
Yeah,
on. Night shift
yeah.
and yep. But thank you again so much. Thank you to Alpha Omicron Zeta for having this space for us to talk. And I hope that this has been as informative for you as it was for me.
Thank you guys
Absolutely.
for
Thank you.
inviting me.
Been
I-
wonderful. Thank you, Dr.
Absolutely.
Elmore.
Thank
you, Freda
you.
Brown. Thank you, everyone.